right, welcome back to Paw Patrol with your host, Dr. Jeff Dykes. Tonight, I am joined by Dr. David Schweibish. Thanks for joining me tonight.
Hey, great to be here, Jeff. I appreciate the opportunity and very much looking forward to seeing what we can chat about.
Absolutely. So for anyone who doesn't know who you are, why don't you give a quick kind of rundown of who you are and how you got to be where you are down there in Florida?
Well, my story's a little dynamic, and I'm not going to make it long-winded for listeners, but, my road to podiatry was a little non-traditional. I kind of tell the story that essentially I was always on a different path than my wife, who is also a podiatrist. She was headed down the medical road and did the pretty traditional prereqs during undergrad and knew that she had a calling to go into something healthcare related. As an undergrad for me, though, I was on a very different sort of path, and that took me into business and into real estate, which ultimately brought me into the Great Recession back in 07 and 08. So many people know that hit Florida pretty hard. So kind of thinking practically, my now wife, then fiance at the time, we were kind of, looking at things very practically and saying, what can we do together in an entrepreneurial way that's going to allow us both to have a career that hopefully we can love and feel is very rewarding. And through a lot of soul searching and spending time shadowing a multitude of different doctors in different specialties, we ultimately discovered podiatry and pursued it together. Both attended Scholl College up in Chicago, loved our experience up there, but felt the calling to come back to Florida, which for me is home and for her is home. And that's where the bulk of our immediate family is, and pursued residency at St. Vincent's Medical Center in Jacksonville, Florida, and ultimately took over a private practice from a doctor that was retiring, and have since worked on growing that practice into a pretty dynamic ship that we have today.
Podiatry is fraught. That's not the right word. It's full of couples. I'm obviously one of them. And I think most of the couples end up meeting in school. So that's interesting that you're a little different and that it sounds like you were a couple before school and then both decided to go down this career path.
You're exactly right.
That's interesting because I think that's pretty unusual. Did you guys talk about, okay, well, I want to do this, but I don't want to be a dentist. Well, I want to be a veterinarian. Well, I don't want to be a veterinarian. And then finally you kind of like shuffle or like draw cards or roll a dice or something. Or it's kind of interesting that you're both like, okay, we're going to do it. We're going to go down this pathway. And
it is. And actually, it's a little ironic that you would mention veterinary medicine and dentistry because they were both part of the talking points that we had back in the day. It was a lot of soul searching and trying to figure out what path in healthcare made sense. My mother, was a career nurse in the ICU. So I had a lot of exposure to healthcare growing up, but never had spent any time with a podiatrist. And it was actually a good colleague of mine here in Florida, who I work on our state association with, Larissa Schmidt. Her parents, Daria and Michael McDonough, are both now retired podiatrists, but we spent some time with them and ultimately kind of fell in love. That coupled with just a realization that we have such an incredible profession that affords so many different avenues that you can go down and obviously allows us to be entrepreneurial, which is not something that every field in medicine can say. And in podiatry, we're dealing with patients who obviously have pain. They're dealing with complex issues that oftentimes they're not getting answers to. Oftentimes they feel like they're a bit frustrated about care that they've received with other specialties. And they need somebody who can communicate very level-headedly, but in a very respectful way. And I think that's what we brought to the table and recognized that we could actually pursue very well and successfully in podiatry. And I believe we've done that today.
Yeah, that's an interesting aspect to think about medicine and the component of customer service, because historically, I don't think doctors cared. If you went and saw someone who's like, is that the doctor? Yeah, like, he's kind of like angry or in a hurry or gruff. And with the advent of online reviews, that seems to have changed 180 degrees because, especially if you work for an organization, I shouldn't even limit it to that, because even if you're in private practice, people are going to go to someone and the first thing they're going to do is Google, and then they're going to look at reviews and see what other people have to say about that place. So I always wanted to turn the tables 180 degrees and start rating patients. Like, if you're going to get to rate me, I'm going to, at the end of your visit, you're going to get a little card that says like 2 stars. You need to wash your feet. Or something.
Hey, ride-sharing platforms do it. Why can't we?
Exactly. I wanted to turn the tables and be like, nah, no, 2 stars, get out.
Yeah.
but that's not going to fly.
No, probably not. But the reality is you're exactly right. I mean, we've now entered a culture where reviews matter, your reputation does matter. But I still to this day hear horror stories. You hear from patients all the time who say, "Oh my God, this other doctor I saw didn't listen to me. They stared at a computer the whole time. They didn't
Hmm.
engage with me. I felt like they didn't really care about my concerns." And I think that as a podiatrist, especially for anybody who's listening who's early in their career, either going through school or even deciding about a profession, if you recognize in yourself that you can be different, you can differentiate yourself from other people in your community by simply listening. You don't have to be brilliant. You don't have to be the best surgeon. You don't have to have a 4.0 GPA. If you're a
Hmm.
good listener and you're empathetic, you can be successful in our profession. And I think that's a big take home message.
I think that's true in any medical profession, because how often do you hear about people telling you, "Oh, I went and saw the, dentist or whatever. Like, how were they? Oh, they were so nice." And like, where'd they get their degree from? No idea. Did they correctly count the number of your teeth? I don't even know how many I have. How
Yeah.
sure, but
Yeah.
all they care about is, were they nice? And you hear that so often. Did they spend time with you? Yep. And they were so nice. And that is the kind of the floor for where you need to be, because customer service beyond that, you've kind of won people over. If you spend a little bit of
Yeah.
time with them, if they feel like you care, then you're 90% down the road. If you
Yeah.
get their diagnosis correct and you make them feel better, cherry on top, that's fantastic. But even if you don't get their diagnosis correct or don't fix their pain right away, you're already 90% down the road. They like you, they're coming back to you, they're going to feel like you have an interest in them, trying to get them as good as they can be.
I think it's also a critical component of how we practice even moving into our careers, whether we're starting off, early on or later on. And as you become more senior and more comfortable, very often it's easy to become a little bit relaxed in your methodology and perhaps even in your delivery. And I think that does bite some doctors in the butt a little bit. I guess putting a different hat on, I do serve on the medical advisory committee for PICA, and I get to work intimately with Luke Ciccinelli, the chief medical director, as well as our other committee members, in trying to really wrap our heads around risk and how it obviously impacts us as podiatric physicians.
Mhm.
And one very universal component to what we see is that by and large, doctors who are loved typically don't get sued. Patients do not like suing a doctor that they like. And
Mhm.
so, if you can build up that level of a relationship with your patient base, statistically, we do know that you are less likely to face any kind of malpractice liability over the course of your career. It's not always avoidable. There are obviously going to be some outliers, but generally speaking, if you fall into that category of a doctor who seems to be well loved within a community, you are less likely to face any kind of legal liability for the care that you render.
Yeah, that makes a lot of sense. So for any of the younger listeners, why don't you tell them what PICA stands for, what PICA is, and what role they serve in the profession?
Yeah, so PICA is the Pro Assurance Insurance Company of America, which is now the officially the largest underwriter of medical malpractice or professional liability insurance in the United States. And if you haven't seen the name PICA being in any way, shape, or form involved in the profession of podiatry, you're probably living under a rock. They are foremost one of the greatest sponsors and industry partners that we as a profession have going through all stages of your career. I mean, PICA is largely responsible for sponsoring and underwriting some of the greatest scholarships that have been given to students to date. They're also responsible for funding a multitude of different endeavors that students go through over the course of their training. A lot of opportunities for sponsorship at the state associations and with conferences that people might attend. So they're really hard to actually avoid, if you will, and that's a good thing because the work that we do within PICA is all about not so much obviously teaching doctors what they need to know to keep out of trouble. It's really just about awareness and opening your mind to the breadth of what it is that we as podiatrists do and the different types of scenarios that you're going to have to face as you go through your career. And hopefully that mindfulness is what will mitigate a lot of issues down the line.
Yeah, it's all about relationships. Well, it's mostly about relationships, but it's also about understanding the other side of the coin to protect yourself, right? Like if you're a provider, you have to have malpractice insurance. It would be catastrophic to anyone financially if they chose not to have malpractice insurance. And so understanding it's not something that people usually like to think about or talk about because it's uncomfortable and sometimes it infers blame or incompetence, which I don't necessarily think is always the case because certain outcomes happen and certain patients have complications and bad things happen. I always tell people somebody wins the Powerball, but somebody else gets hit by lightning. They're two rare events. One's good, one's bad, but sometimes you can control those things and sometimes you can't. So protecting yourself in that situation to have that protection, for lack of a better word, is absolutely necessary. And so I think it's helpful that PICA not only serves that role, but also does a pretty good job of reaching out and making sure that people understand what's going on, training people, and you always get a discount if you attend some seminar or online thing to be more educated about the process and how things work, which ultimately obviously helps PICA because they're going to have, if the provider is going to have better outcomes, that's better for PICA. It's like this better for everyone situation if everyone's all on the same page there. But very important aspect of medicine that we don't generally tend to talk too much about.
You're right, and I think that that's very unfortunate because it really shouldn't be some kind of a hidden talking point that makes people uncomfortable. It's the reality of medical practice in the United States today, and in some states it's obviously a bigger problem than others. But by and large, every community has a risk pool, and you play in that pool, and really should be aware of kind of what goes into that particular little world that you live in. Ultimately, we know with the work that we've done with PICA and the data that we obviously gather that some areas are more prone to issues than others. Some groups, some settings are more prone to issues than others. And I think that as a practitioner, you really owe it to yourself and to your patients to know what kind of pool you're playing in, whether you're in a highly, reconstructive surgical environment, very academic, you're pushing the envelope and testing the waters of new technology. That obviously comes with some inherent risk versus a very community-oriented, non-surgical podiatrist who kind of does bread and butter work. Very different risk environments, but by and large, as you mentioned earlier, it's not necessarily about errors in judgment or errors in care. A lot of times it comes down to documentation. You may have done the right things and the standard of care may have been met, but because the technical aspect of your care, the documentation you rendered was not up to par, that's what loses you the case. So there's so many elements to risk awareness that I think a lot of people are not aware of. And so we're trying to do the work to bring that to the table and obviously make people aware at a very young age, very early stage in their career, what they need to know to stay out of trouble.
And the other thing that's important for people to understand is that all of this medical malpractice stuff varies from state to state. Each state has different caps on medical malpractice settlements or finalized decisions. I'm drawing a distinction between a pre-trial settlement and a post-trial decision on the amount of capped damages, but every state's a little bit different from that standpoint. And that's obviously going to affect your rates. If you're in a state with a lower cap, you're going to pay less than a state that maybe doesn't have a cap at all. So there are lots of things that go into that to understand. And it's not to say that, well, don't live in Louisiana because you're going to get sued and they don't have a cap. I mean, it just is what it is. It's not saying that you're going to have to pick the state based on that, but it is something maybe that people should be more aware of in terms of why they're paying what they're paying in what state they're living in.
That's a good point. Yeah, and those premiums do differ. I mean, I've got colleagues who are obviously practicing in relatively higher risk environments like Chicago, LA, New York City, Miami, where the premium that they face is much different than what we might have in Alabama, for example, or in Tennessee. And it's just a byproduct of, the different verdicts that come out of different trials, what kind of settlements they're seeing. And again, like you said, the economic damages, whether there's a limit or a cap in place based on the tort laws. And you should, when you're going off to practice at any stage in your career, you should be aware of what that risk pool looks like wherever you're headed.
Absolutely. You want to talk a little bit now about what you are doing with your involvement with the APMA, the American Podiatric Medical Association?
So the APMA right now is, to me, I think one of the most exciting sandboxes to be in all of podiatric medicine. I think over the years, and again, I'm not that senior in practice, even though I've got some gray hairs coming in my head that my barber reminds me of every time I see her every couple weeks. But I've been involved now in leadership within our profession ever since my first year as a student at Scholl.
Mhm.
And all of that work has kind of provided me with exposure to the work of APMA in a very interesting way, because when you start off as a student, you're eager, you're excited, you have the concerns of your student body first and foremost in your mind. I don't know that you're really thinking about the profession at large the way that a practitioner is.
Sure.
But over time, as you get off and you go into residency, you obviously usually take a little bit of a sabbatical, if you will, from any kind of work like that while you're in residency. And then you come out into practice and bam, you're hit like a truck with all of the weight of our profession, the things that burden practitioners, from billing and coding issues, legislative issues, worrying about how we interact with other specialties, not only within medicine, but obviously allopathic and osteopaths and nurse practitioners and PAs. So
Mhm.
all these different little hurdles and challenges that we have to face as professionals is within the purview of the APMA. And APMA has obviously gone through evolutions. I mean, again, I've been involved in our profession now for over 15 years. So anybody who's been in the profession for 30, 40, 50 years has seen a lot over
Mhm.
that time.
Yeah.
50 years ago, there were still doctors who were having struggle getting any kind of hospital privileges, let alone surgical privileges, let alone, the ability to do the breadth of what we can do today.
Sure.
So in my short career, seeing this evolution from a profession that afforded, people a great career to something now that to me is getting ready to head onto a rocket ship is absolutely fascinating. We're under the leadership now of an incredible new CEO, Megan McClelland, who for the past year has done the job of inheriting, if you will, a profession, an entire profession of about 20,000 of us in the United States who are by and large a happy group of people. I mean, if
Mhm.
you talk to the average podiatrist, most podiatrists, generally speaking, are fairly happy. There
Yeah.
are obviously going to be people who naysay things. There are going to be people who are disgruntled, or maybe they feel disenfranchised by the way
Which is
things have
not unique to
developed.
podiatry.
Not
Does
unique,
not unique
exactly.
to podiatry.
You got it. But those people, unfortunately, I think that they rest a lot of those issues on the APMA, and they find it at fault. They feel that the APMA has let them down, or they didn't do enough, 20, 30 years ago to help overcome some of the legislative hurdles, or other work at the federal level that should have been done to keep us on the right path. Here we are today, though, and whether or not you want to, we can sit here and talk about the past till we're blue in the face. We
Mhm.
have to deal with the challenges here and now and try to tackle them the best we can. And when you have leadership like Megan at the helm, who not only understands very well what our issues are in such a short period of time, I feel like she's kind of become a pseudo podiatrist in her own right, even though she's not a podiatrist.
Yeah.
She understands very well what the plagues in our profession are. And I think the trajectory of what we need to do to help to really start to not only tackle them, but to set ourselves up for the right kind of success that hopefully will not involve as many hurdles. And I think that's a really big point to make, because we've been a profession that likes to fight battles a lot. And I think that internally, a lot of those battles have been what have kind of held us back. So the more of those silos that we break down and start to communicate interprofessionally, I think we're going to get way more momentum than we've ever had in the past.
I think I will echo your sentiments, and I will say two things. Number one, the people that are disgruntled perhaps need to look in the mirror and take some accountability for why things are the way they are. And number two, the people who are disgruntled tend to look a certain way, which means they have way more gray hair than I have. They tend to be an older population who maybe the profession was not what they thought it was going to be. I work with students, residents, I'm on the podcast, I'm online, I'm in a lot of places. I don't think I've ever heard person younger than me be disgruntled. I'm not saying it doesn't exist. I'm saying that if we wait a little bit longer, a lot of the disgruntled natured people will tend to kind of fizzle out over time. And I think that's a sign that the profession is moving in the right direction, because if the profession was in a bad place, then you would hear younger people being more disgruntled or more unhappy with their career choice, but you don't tend to see that as much. I think the number of people who are dissatisfied with choosing podiatry as a career choice is diminishing, which means either those people are just aging out, or what I think is the career is on an upward trajectory, like you said, as we get more surgical privileges, as we get, better reimbursements, which is just a difficult uphill battle for all physicians, not limited to podiatry. But as those things tend to change with time, I think the profession is headed in a popular or headed in a great direction, especially with Megan at the helm. I met her at ACFAS and she's fantastic. She seems like she's engaged. She's ready to hit the ground running. She cares, and she wants to see the profession get to new heights that it hasn't seen before.
Exactly. That energy was something very palpable at the annual scientific meeting in Fort Worth, Texas, just last week. You could feel it. I mean, I think that a lot of the attendees who are not necessarily involved in APMA, they're not involved in committee work, they were excited. They were excited to see a lot of the new work that's being done. They were excited to hear about news and agendas and all of the strategies that are being set into place to really keep things moving, not only in the right direction, but in kind of a new dynamic direction, which I don't think that we've ever been able to see before. It's not to say that previous leadership, didn't have big wins and make a lot of strides for our profession. I think now it's just time really to hop onto a different set of tracks and get our profession going where ultimately we know it has the potential to go. And I see that same thing in our students. I mean, I work pretty intimately with a lot of the students at Barry University, a School of Podiatric Medicine. They are so excited. They're so engaged in what we do. They care about the work at the state component and within the APMA. So I know that the future of our profession is great hands. We've just got to set things up the right way for them. That's kind of the idea.
I want to talk a little bit about student recruitment and the awareness of podiatry in the eyes of the general public, and specifically in the eyes of high school and undergrad students being aware of the profession and the percentage of those people applying to podiatry school. Because I want to paint two different pictures and see where you're at with all of this, because it's one of those like high school debate things where I could argue either side. You tell me which one to go down and I'll argue whichever side you tell me to. So student recruitment, obviously the number of applicants is down. The downside of that is that the schools are taking a quality of student that could in theory be below what they could take if there were more applicants. You can be more choosy because certain schools run on budgets and they end up taking some students that maybe they shouldn't. On the flip side of that is when you're out in practice, if we're working so hard to increase the number of applicants, in theory, based on how economics work, if more people apply, more schools are going to accept more students. They're going to fill their seats, which is then going to make more podiatrists, which is then going to make more competition. And on an economic basis, if let's say this, if 10 people are vying for the same job instead of 2 people, the chances are that someone among that 10 is willing to accept a lower dollar amount for that salaries. And you could make the argument that more competition drives salaries down because there's someone out there willing to take a lower salary. So it's this weird thing where we want more student applicants and we want more schools to fill with good applicants. But you could see why some people would say, I don't necessarily want that because I don't necessarily want more competition. Again, I can argue both sides if you tell me which path to go down, but what path do you go down? What are your thoughts on all that? Because it's complicated.
It is. So, I mean, first and foremost, let's just think about market dynamics. You talk about the nature of competition and, I don't know that I want more podiatrists in the marketplace. I don't know that I want more out there. Let's not deny the fact that there's a huge need for podiatrists nationwide. There are massive swaths of geography
Yeah.
all over, probably in every single state in the country, where there's a void of podiatrists and they're needed.
Yeah.
I talk to colleagues all over the place who recognize that there are podiatrists who are not available to do work not only clinically, but surgically, caring for individuals in skilled nursing facilities. I mean, those voids are undeniable. So to
Mhm.
sit here and think that individuals would somehow clutter the field of competition to the extent where it could put another podiatrist out of business, I think that's a little bit far fetched. There are certain areas with a lot of saturation,
Yeah.
Miami, New York City, Chicago, so on and so forth, where,
Where the
yeah,
schools are
you got it.
tends to be
Yeah.
where the schools are and where the residencies are. There's going to be a lot of people who end up wanting to stay in that place.
Exactly. Yeah. And then also your very, your popular areas like San Diego where people just want to live. Those types of places are going to have more market forces in play where you're going to have to differentiate yourself. You're going to have to develop a niche. You're going to have to be smarter about how you practice, more ancillary care, perhaps more cash-based services, be more mindful of customer service and quality and reputation and all those things. So I think from a market standpoint, we can hopefully acknowledge and agree that there's a need for podiatrists where there are none now. So
Mhm.
hopefully that's not really a factor in the equation. I agree. I mean, I do know that some of the schools, are facing a bit of a crisis with regard to managing budgets, developing the finances to meet those budgets, and how you bring in tuition dollars to make all that happen. I'm not involved in academia. I'm not part of faculty with any of the particular schools of podiatric medicine. But in conversations I've had with individuals like Dean Jensen, for example, I feel like at the Arizona College, I do believe that there's a bit of a balance that you can achieve. And I'm hoping that the colleges are doing that by and large as they're working through the inability in some ways to get a big basket of applicants like they've had in the past. We're working through it. I mean, we know that there's a huge campaign that's rolled out nationwide, the Feet on the Street again, which is kind of Dean Jensen from Arizona is at the helm of this with the AACPM. All these parties, all these individuals, the stakeholders within our profession who are doing the work of engaging with students at the pre-health level, whether that be in high school or college, to bring awareness to our profession and make people aware of what it is that we do for our patients and the quality of life that we afford for them and for ourselves, frankly. And I think the more that that word gets out and the better that we're able to paint that picture with smart marketing, very targeted marketing, then I think we're going to start to see fruit in that in terms of the data that we're getting from the various respective colleges.
I think it's as simple as awareness. If people aren't aware of whatever profession it may be, how could they possibly select that as their profession? The more people that are aware of, again, we're talking podiatry, but whatever specific profession you're making them aware of, then that's by nature going to increase the number of people that go into that, because one is higher than zero, right? I'm not very smart, but I know that. And so anybody that potentially goes into podiatry because they were made aware of it is more than what was going to go into it for the people who weren't aware of it. And so I do see that changing. My wife and I spend time at the University of Iowa, who now has a pre-podiatry club, which is a very rare thing. There aren't a whole lot of universities that have a pre-podiatry club, but there was a student at the university whose mom was a podiatrist, and she decided to start the club, and now they have like 30, 40 members. And then as people matriculate through, I think a decent number of them did end up going to podiatry school. So things like that are very simple, but it's ultimately based in the root of awareness. And so these marketing campaigns are very helpful, but it almost also needs to have people that show up to undergrad or high school institutions, do a career day. My wife and I we do like a surgical skills lab where they had different surgical instruments, and they got to do these little games where they had to try to throw a K-wire and hit a target on the other side of this wooden block. And it gamifies it, but that makes it interesting to these students, and that's going to pique their interest, and they're going to say, well, that was really fun. What was that again? Was that podiatry? Oh, I got to look into that and see what that's all about. But it's multifactorial is my point from all that. I don't think you can just rely on one marketing campaign or one person and just sit back and say, okay, APMA is taking care of this. I think it's inherent to the people out there, anyone listening, that they be a good steward or uh, uh, advocate for podiatry. And maybe that's just, I don't do much, but I've had quite a few people tell me, hey, I found out about podiatry because of your podcast and I'm going to podiatry school. And it's like, well, that's really cool. That was one of the goals of the podcast was awareness, but simple things. Not everyone has to start a podcast, but if you want to, sure, go for it. Go ahead. But everyone can do something on their own to try to help out the profession, I think.
Yeah, you're right, Jeff. I mean, it doesn't take much. I mean, whether it's a career day type of activity at a high school or at the college level, engaging with pre-health organizations at your alma mater, for example, going to different community events like the Special Olympics, volunteering, any of these things is going to create awareness and create a buzz. Statistically, we know through the data that Dr. Pat DeHeer, one of the APMA trustees, had cultivated over the past several years, we know that individuals who shadow other podiatrists are exponentially more likely to become podiatrists themselves and actually go to school for podiatric medicine. That's the power of what we do. We have a truly fascinating profession that is interesting. I mean, like you said, it's surgical. We're using K-wires. We're doing dermatology. We're doing orthopedics, biomechanics, pediatrics. All these different things are truly fascinating if you have any interest at all in healthcare. And I think once you actually open your eyes to what it is we do and talk to the people who are champions of our profession, they're cheerleaders of our profession, it's going to not take a lot of work to hopefully get excited yourself and find yourself wanting to learn more.
Absolutely. If you could trade places with one other medical specialist for a week, what would you trade places with and why?
Great question. So the answer for me is ophthalmology.
I'm going there. I can't do eye stuff.
I hear that a lot. But I don't know, something very fascinating about ophthalmology to me. I think that, from, things I've read or heard or seen on social media, videos, and having some conversations with ophthalmologists over the year, they seem to have a very intriguing specialty in medicine. And I think that a lot of the surgical work they do is truly in its own little world. So to be able to trade places with them for a week and get some exposure to that would be very fascinating to me.
That's interesting.
It's an interesting question, though. I've never been asked that. So
there you go. Welcome to Pod Patrol.
Hey.
What do you think the biggest misconception about podiatry is? I think that people historically have thought one thing about, the chiropodist or chiropodist, however people choose to say it. And that's just, we got to take grandma to the chiropodist. And that was the way that they thought of podiatry for a very long time. As time has moved on, welcome to this century, people don't tend to use that word or think about that in the same way. But what do you think is the biggest misconception about the field?
Yeah, I mean, from a public perspective, I think that the biggest misconception is actually the incredible diversity of what we manage. A good colleague of mine who also serves on the executive committee for the FPMA, Dr. Tim Miller, who I consider to be a best friend of mine, he actually kind of coined this term recently: below the knee, come see me. And that's the reality of what we do. I mean, we treat pathology below the knee, which, when you think about the complexity of that anatomy, opens your mind to what we do. And I think that a lot of patients come in, like you said, thinking that we are the toenail doctors or we're the toe doctors, and that's kind of the extent of it. And the second you move more proximal than, the MPJ, you need to see an orthopedic. Well, we've evolved, and our profession and the way that we're trained, we are, without question, in my mind, the preeminent foot and ankle specialists of the world. I truly believe that we are the gold standard in terms of training and the quality of our output. And I see that every day with residents coming out of programs. Incredible training. I mean, blowing anything even that I did years back out of the water. And it gives me great hope to see that not only where we were just a matter of years ago, but where we're headed with such rapid speed. I think from a misconception standpoint, it's really just the fact that people do not understand the type of pathology that we actually manage.
I still see patients who are in my office. They are sitting in my office and they don't know that I do surgery. I mentioned something and I try to take the time to educate each one. It's probably not the most effective way to educate the general population, one patient conversation at a time, but they say something about surgery and I say, "Oh yeah, I do this and that." And they're kind of always like, "Wow, I didn't know any of that." So it's slowly changing, but even to this day, I mean, I'm proud of my training in Pittsburgh and my ability to fix certain pathologies that are rather complicated. And still, the patient sitting right in front of me doesn't know that I do that. And so it'll just take some time and change. But there, I don't know if we want to go down this path, but not calling yourself a podiatrist, I think has been very difficult for the profession. And some people draw far away from the term podiatrist. And then now we're in the muddy waters of confusion because if the people who are highly surgical aren't calling themselves podiatrists, how could the general public understand what a foot and ankle surgeon is? Oh, that is a podiatrist. Or, but maybe it isn't a podiatrist. Maybe it's an orthopedic foot and ankle surgeon. If we can't even agree on what we call ourselves, how can the general public understand what we are and what we do?
It's one of the greatest dilemmas in our profession, unfortunately, the branding. I mean, branding has probably shot us in the foot quite a bit with regard to the student recruitment crisis that we're in. And I know
Yep.
it's a major talking point in my conversations with members of the board of trustees of the APMA and a lot of people who are very intimately involved in the student recruitment campaign. We know that that nomenclature matters. It comes down to a lot more than even marketing. It's about the conversations we have with potential students. Are you a foot and ankle surgeon? Are you a podiatric surgeon, a podiatric physician, a podiatrist, a foot and ankle specialist? I don't know that there's necessarily one right answer. I've heard phenomenal rationale for each and every label. And I
Yeah.
think that ultimately we're going to be able to encompass multiple of them. I don't know that we necessarily need to pigeonhole ourselves into one, but we
Mhm.
really should come to a consensus. You know, we are a small profession. I mean, there's, like I said, there's about 20,000 or so of us around the country. So we are not a massive army, but we are a very powerful one with a very strong voice. And so we need to start having a lot more discussion and not being afraid to look across the aisle, so to speak, and say, hey, listen, those people in that association or in that subgroup of our profession, they're weird, they're different, or they don't want to talk to us. That has to stop. The divisions, the fragmentation have only held us back over the years. And I think finally we're at a point where a lot of those people who have stymied the progress are either retiring or they've kind of departed from the world. And now we're getting people on board who want to actually get engaged and start breaking down the barriers.
I agree. We're too small of a profession to have division within the field. I mean, it just seems so silly if you took any other field and you said, hey, in the field of dentistry, there's some of them who call themselves dentists and some of them call tooth and gum surgeons. They're like, well, are they different or are they? No, they just want to call themselves something different. And you're like, well, that sounds like a recipe for disaster for that profession because if you're divisive within your own profession, how can you grow the profession and be as strong as you can be if you can't even agree with each other within the profession? I think it's an
Exactly.
issue.
Yeah, I think they deal with enough with the DMD versus DDS degree,
Oh,
and I
I'm
think they
sure.
try to kind of bury that under the rug and not talk about it too much because some patients might get confused. But yeah, I mean, you know that common theme about how we introduce ourselves and how we talk. You know, I've had patients tell me, well, I had surgery with this doctor up in Michigan and da da da, and I come to find out that it's a podiatrist, but because of the branding, because of the spin on the fact that they're a foot and ankle surgeon and all I do is
Hmm.
foot and ankle surgery, they think that I'm different. They think that
Hmm.
I'm not in that same playing field. And again, that's just a difference in the way that we semantics. That's really all it is.
Absolutely. What advice would you give to younger people in the field who are looking to eventually obtain roles in leadership, whether it be with a state organization or on a national level? What advice would you give for them to how to get involved and kind of what's that first step to take?
So the first step to take, I think, even really before you do any kind of engaging with somebody, is to have an understanding of who you are as a person. Each person has their own inherent strengths, and whether it's your ability to communicate through written form or spoken form, or maybe you just enjoy working on numbers, you enjoy working on data sets. Some individuals are far better served, working on things in the scientific or research realm. Once you've identified that for yourself, then I think you can start with simply having a conversation with somebody who's doing that kind of work. That's it. It's as simple as that. I tell the students at Barry University, all you literally have to do is tap on somebody's shoulder at any event, whether it's a small, county component meeting of the associations or at any of our big state events or the national events. Simply tap somebody on the shoulder and say, hey, listen, I heard you speak earlier about XYZ topic. I'm curious to learn more. I think you're going to be very hard pressed to find any of us in our profession who do the work within the associations, either at the state or federal, at the national levels, and not be compelled to want to talk with you about it.
Mm,
All of us are passionate. We care about what we do, and we need the next generation to step up to the plate and get involved, because unfortunately, we really don't see the volume that we need. We want more people at the school level, the residency level, fellowship level to take ownership in their profession and take ownership in what they're stepping into and say, listen, I need to have a seat at the table. I need to have a voice in this process so that when I'm in practice, I'm not simply just flying by the seat of my pants and hoping that the tides are turning the way that they need to for me. Waiting until the XYZ hits the fan is not the way to go about it in practice. We've got to start doing the work early. We've got to have discussion. We've got to develop the right strategies so that as things evolve, we can get ahead of them rather than be reactive about them, like unfortunately a lot of things have been in the past. So to those younger individuals who are listening and who are curious about what we do and how to get involved, tap us on the shoulder, send me an email, send me a message on LinkedIn or on Instagram and say, hey, here's who I am. Here's what I'd like to do. How can I get involved? And I usually give the advice, start small. Don't expect, you don't need to be a state leader or a huge committee member within the APMA to have an important role. You may
mhm.
simply need to come to one conversation about one topic at one meeting, and you could have played an incredibly vital role in the way that that subject matter moves forward. So there's many ways that we at the state level and again in the APMA are looking to bring more young blood into the mix. We just need the people who are excited, eager, and willing to step up to the plate and do it.
They're out there.
They are.
There's lots of people. I've been impressed by a lot of younger people in the profession and in terms of their readiness to get involved with the profession. So
I
what
am
is
too.
one
Yeah, I mean, I'm very excited. I think that the way that I've seen these classes develop in all the colleges is truly incredible. They're highly diverse, very engaged people who discovered podiatry through some very interesting ways, whether it's, personal injuries of their own or
Mhm,
family related pathology that they had to help deal with.
yeah,
Those intimate stories, those really personal connections to our field are what make for passionate doctors. And I think those are the ones who help drive the bus at the end of the day.
absolutely. What is one pearl that you've learned since residency? You didn't learn it in school, you didn't learn it in residency. Maybe it humbled you, maybe it surprised you. What is something that you've learned since residency that you could pass along to some of the younger people?
So, having been in practice now, so let's see, I am exactly going on my 8th year out of residency. So, in those 8 years in private practice, mind you, okay, I believe that one big pearl and a take home that any individual in practice, and I don't care what kind of setting you practice in, we as physicians, I think we in our minds have inherently a lot of altruism. Hopefully, we all go into the profession of medicine wanting to serve others, wanting to help others. And all too often, I don't know that we're actually being mindful of our own selves. And I think in those 8 years that I've been in practice, I've realized that that oxygen mask phenomenon is very, very important. You've got to care for yourself before you can care for others. So hopefully, if you're listening to this and you're feeling a bit of burnout, or you're feeling like, am I really doing something where my heart is in it 100%? If you're questioning that and you're really feeling a bit of frustration, hopefully you take a step back, you do the proverbial smelling of the roses, and you find the things that make you feel whole, whether that's family or recreational activities, reading a book, whatever it is. You occasionally got to step back and take time for yourself. And I hear from a lot of colleagues, unfortunately, that I don't know that they do that enough.
Hmm.
And healthcare is a very, very heavy profession. It's difficult. We deal with a lot of complexity. We deal with patients and all their issues and insurance and all those issues. And if we're not worried about ourselves first, we're ripe for burnout. And burnout is such a huge topic in our field. I mean, lectures are being given about it, books are being written about it. Suicide is unfortunately a very real concern within healthcare. And I
Yeah.
think at the heart of it all is really just about being mindful of self before you can care for others.
I think that's a great tip because that's often overlooked because I hear patients tell me often, usually an elderly couple, and they say, I've been caring for my spouse and I've neglected my XYZ. I've neglected myself, my blood pressure medicine. I haven't seen the doctor in 3 years because I've been taking care of my husband. And the people that care for other people often neglect the care for themselves. And what better example for that than a doctor who that's all we do all day long is care for other people. So I think that's a fantastic pearl. You took that in a different direction than I thought. You took it into a more psychological
Sure.
and philosophical approach, but I completely agree with you. I think that's a fantastic tip for people. What role do you see AI, artificial intelligence, playing in the role of, or what role do you see artificial intelligence playing in the field of medicine, specifically podiatry, as we move forward? Because it's here to stay, whether people want it to be or not. What are your thoughts on artificial intelligence and its how it can be incorporated into the field?
So interesting you would ask this question. I just had the privilege of serving as the breakfast symposium speaker on Sunday morning at the annual scientific meeting in Fort Worth last week, where I gave a 90-minute talk about this very, very topic.
Hmm.
And artificial intelligence has now evolved to be this omnipresent thing. I mean, it is truly ubiquitous. We can't escape it.
Yeah.
If you're not learning about it on TV or on the radio, you're probably living under a rock.
Hmm.
We have to accept the fact that AI is here to stay and it's expanding. Okay. Personally, with again, the things that I've learned about AI and how it's starting to infiltrate healthcare and podiatric medicine as a specialty within that field, I don't believe that AI is here to take away our profession. I don't think that it's going to replace podiatrists. I think that we have such a powerful manual skill set that is very hard to replicate, even with the robotics that have been developed to date. I think they're far from the ability to actually do the work that we do to the capacity that we do.
Yeah.
Is that to say that 30 or 40 years ago, that may not be the case? I don't know. It's hard to read that crystal ball. But what I
Hmm.
do know is that AI is something that we're already seeing become part of our profession. Again, putting on a different hat, I do work as a clinical consultant for Baco Diagnostics. So, in the dermatopathology realm of our specialty, we already know that AI is playing a part in the way that dermatopathology is being interpreted.
Hmm.
There's software being developed already that is on par with board certified dermatopathologists. But even in their field, when you talk to those individuals, they look at it more as technology that's going to augment and
Right.
improve the way
Yeah.
that they practice rather than replace the way that they practice. We've seen AI starting to do work in, for example, fracture diagnostics or tumor diagnostics. The radiology world is really starting to feel the effects of AI very powerfully. In
Yeah.
fact, actually, there was a group of students at Barry University that had developed a poster that they had presented at the SAM conference in January, investigating the effects of AI in terms of MRI diagnostics, fracture diagnostics, and things of that nature. So it's
Hmm.
it's amazing. It's truly a powerful modality that we need to embrace. We need to figure out how to incorporate it into our practices as it evolves. Hopefully, not be afraid of it and rather embrace it and actually learn about it. Because there's already about 2/3 of the physicians in the United States are using AI in some capacity within their practice. Majority of them are using it in their EMRs, either through chatbots discussing things with patients for patient scheduling, or
Mhm.
perhaps for billing related work. And that number is only continuing to grow. So I think as younger doctors come into practice and other doctors transition into settings where there is new technology, you're going to be faced with having to adapt to it and to figure out how AI is going to augment your practice, hopefully not replace it. So I think we're very, very far from any risk of it really encroaching upon the work that we do. I think it's actually more here to help.
I completely agree with you. I think you could view it as one of two things. You can view it as how can it help me, or you could push back against it and say, this is not what I signed up for, and technology can't do what I do. But I think the smart people are going to be able to embrace it. And we talked about burnout and how do we utilize AI to make us more efficient and to cut down on some of that superfluous work, billing, coding, notes, EMR, clicks. How many clicks does the average doctor make in a day, right? It's probably astounding the number of clicks that we perform every day. How can we utilize technology to make us more efficient? And in theory, you either get to go home and see your kids sooner or you get to see more patients, your choice. But at the end of the day, the less time we spend doing things that none of us want to do, which is clicking on a computer, typing on a computer, dictating into a computer, clicking the right box, and then clicking the next screen, clicking the next screen. It's going to be helpful. It's slowly moving in that direction. I don't think anything pops up and it's instantly the way that it's supposed to be. If I handed everyone listening the first iPhone, they'd probably throw it back on the ground and be like, what? This is terrible, right? But at the time, it was revolutionary. I was like, this is completely different than every flip phone. Young people listening are like, what is he talking? What's
What?
a
Yeah.
flip phone? Google it. Ask ChatGPT what a
Yeah.
flip
Yeah.
phone is. Ironically. And nothing hits the ground and is instantly perfect the way it is. We're gonna be the generation that has to slowly, slog through figuring out how to utilize AI to the best of its ability in order to help us. But I think the people who push back against it are in for an uphill battle. The people who choose to utilize it for good and figure out how it can help them are going to be far beyond the people who don't.
Yeah, and I can understand the intimidation factor. I mean, just like what we went through back in the 90s when, personal computing started to, develop traction. People were like, I'm really going to bring this machine into my bedroom or into my living room and start talking with people on it and getting these email things. It was abstract. It was very odd. And in fact, my
Mhm.
mother, having been a nurse at the time, that's actually kind of what drove her into retirement, was the introduction of EMRs in the hospital setting. She
Yeah.
was so intimidated by having to do computing work and typing charts and all that that she said, forget it, I'm not going to deal with it, I'm used to pen and paper. And she
Right.
was done. So the doctors that are out there who just now maybe adopted electronic record keeping and are looking at AI as some insurmountable hurdle, I encourage them, go to a conference and talk to the vendors and let them show you how oftentimes relatively easy this technology is to adopt into your practice and make
Mhm.
it part of your day to day. So, like you said, hopefully you spend more time with family, less time charting, less time working through codes, because the power is there. It's definitely not perfect by any means, but what's incredible to me is the speed at which they're working through the problems. I mean,
Mhm.
literally month over month, what was an issue in one program 6 months ago has been completely eradicated and is no longer a problem. And then a newer development, comes up and newer updates, and it moves so rapidly that I think that as problems come up, they're able to tackle them a lot more quickly than we ever could in the past.
What I find fascinating is that you can use AI to help solve the problems with AI. You can leverage the use of AI and input a bunch of data and figure out what is the issue with this. You're utilizing AI to figure out how to fix AI and make it better. That's kind of a mind F if you think too hard about it.
Yeah, it's a brain bender. I mean, and I think that's where if you really want to broach the topic of the scary side of where AI could take us, exponential growth of information or of intelligence could be an intimidating thing. And I know that there are, the pioneers of AI out there working for Meta or Google or whatever it might be, who are working on these supercomputers that are just of absurd or obscene levels of intelligence. Hopefully, we as a society and we as, international thinking bodies will create limits and not allow these things to get out of hand. But I think that's for a whole different podcast. So
I've seen that movie. I've seen that
Yeah.
movie time and time again.
yeah,
They're fascinating, aren't they? When AI goes rogue,
yeah.
it's fascinating, and we hope we don't get to that time frame. But I can see the hesitancy there from some people who've also seen those movies.
Exactly. Yeah. And I think, and the one undeniable fact about AI is just the actual financial impact it's having on the world. I mentioned in my talk last week that the overall market that AI is going to fill will be equivalent to the entire German economy, the third largest GDP in the world,
Wow.
within about 5 years.
That's fascinating. Buckle up. We're in for a ride.
That's right. Yeah, but I'm glad to be I'm glad to be living in this day and age where we've got the technology that we do, we've got the advances we do, and we're getting to witness it kind of firsthand.
Yeah, it's fascinating. All right, it's time for the Pod Patrol 8 rapid fire questions for you. You ready to go?
I hope so.
All right, question 1, coffee or soda?
Coffee.
Number 2, custom inserts or off the shelf?
Off the shelf.
You're given a TED Talk tomorrow. You have no time to prepare. You have to lecture for 1 hour. What are you an expert in? You have no time to prepare.
At this point now, artificial intelligence in healthcare.
There you go. We could keep going, couldn't we? Bunion surgery, head procedure or Lapidus?
Head procedure. And I'll add to that, minimally invasive.
Best shoe brand to recommend to patients?
Brooks.
Favorite surgical instrument?
Ooh. That's a tough one. Probably the old school Wheatie, just a good Wheatlander retractor. Yep.
Oh, I love that. I was using that today. I was doing an ankle fracture and just crank it open. Let me see everything.
Can't beat it.
Worst OR playlist: country music, opera, or electronica?
For me, probably electronica.
I'm with you.
Yeah.
Although I'm not a huge opera fan.
Yeah.
The one condition you never want to treat again. Starting tomorrow, you never have to see this condition again.
Honestly, probably Charcot.
Charcot's tough. That's a tough one. I had Dr. Weinraub on, and he said diabetes. And I was like, wow, you just crushed like an entire, you just like solved a whole lot of problems
That's
there.
a good point. Yeah. But he would come up with that too.
Yeah, it's pretty good.
Yeah.
All right. Well, thank you so much for joining me tonight on Paw Patrol. I appreciate your time.
Yeah, Jeff, no, this was great. I'm such a big fan of yours and glad to see where this podcast has gone. And it was truly a privilege of mine to be on here. So thanks.
I appreciate the kind words. Thank you so much. Thank you guys for joining us on this episode of Paw Patrol with your host, Dr. Jeff Dicus. We'll see you guys next time.
Disclaimer. Opinions expressed are those of the content creators and do not represent any employer or entity. The information shared is for informational purposes only and should not be construed as medical advice or used in any legal capacity, including establishing standards of care. All efforts have been made to comply with HIPAA regulations. No guarantees are made regarding the accuracy of statements or opinions provided. Interaction with the podcast does not establish a doctor-patient relationship. Please enjoy this podcast responsibly.